Hi everyone, this is Dr. Hikmat from VIP Med Spa Clinic. Today I'm going to show how I apply hyperdiluted Radiesse for skin rejuvenation and also skin tightening. As you see, my patient Vicky, her complaint is actually jowling, and she feels like her skin is loosening, especially she has lost over past 2 years quite a bit of weight, and one of her issue is the lower jaw and also corner of the mouth feels heavy. She wants to a little bit lift her face like toward the side. This way she doesn't like to be cheeky by injecting too much of filler. So we decided to actually go and inject the hyperdiluted Radiesse to side of her face to try to anchor. Of course, as you know, Radiesse is calcium hydroxyapatite. It boosts collagen stimulation. So I'm trying to anchor them in the side of her face to help to make her skin tight on the side, but doesn't make her skin or her face look like too chubby and like too overfilled. So I'm going to show you the whole process, how I do it, and hopefully that can be helpful to understand the whole concept of hyperdiluted Radiesse. This is actually Radiesse Plus, and I'm using 1 syringe. This syringe actually is 1.5 cc. Usually for skin rejuvenation, we actually use the dilution of 1 to 3, means 1.5 cc of Radiesse Plus, which already lidocaine is in it, and also 4.5 cc of normal saline. Then I use a connector, which I'm going to show here now. This is our 4.5 cc normal saline. It would be actually very, very thick product. As you can see here, it almost look like a toothpaste. I do a few times to make sure I get everything out of the original syringe. And then I attach second syringe to mix them and to make them completely diluted. You can see here how we do almost like 20 times, and it becomes very milky and soft. In the next video, I'm going to show exactly the technique that how I do injection into the skin. I will just give patient small amount of lidocaine injection to just numb in the area that my cannula would enter into the skin. Then again, before even injection, I try to move the Radiesse few times to prevent from depositing. And then I transfer to the smaller syringe, which almost like a 3 cc syringe. And this is now almost 6 cc product. So you can actually divide them to 2, 3 cc and inject 3 cc to each side of her side of the face. So I use cannula technique, and I already numbed her. So I'm gonna enter into her skin like just a small tiny opening with the sharp needle, which is your guide. And then I'm going to show very easy. Cannula actually moves intradermally. And you try just put a small amount of product into her skin. You don't need a lot. This is biofiller. You just need to kind of like fan it a small amount. And I'm doing actually a lot to the corner because I'm using them as anchoring, and that helps a lot for lifting her cheek and also prevent her from that jowling. I'm going to come a little bit toward also front, close to the corner of the mouth, to make her skin look tight. The dilution that I'm using now is 3:1, so you're not really volumizing, you're just using this for skin rejuvenation. Almost done in this side. Okay, here I'm going actually to just give a small amount of lidocaine to numb the skin, which makes patient more comfortable when you're entering the sharp needle for guidance of the microcannula. So here patient doesn't feel as much. This is almost 25 gauge microcannula. I'm actually gonna transfer the rest of my diluted Radiesse. As you can see here, even before injecting to patient, you better actually move it a few times. And that makes them completely well mixed with no more saline. Again, I'm transferring now to the 3cc syringe. I attach my cannula back. I take the guide out of the patient's skin. And now I'm going to go intradermally. And as I said, I'm more focusing on the side of the patient face, mostly to create like collagen boosting on the side of the face to help for retraction and try to pull the skin up. This is hyperdiluted Radiesse 1 to 3. That's why it doesn't give you volume, actually just create skin rejuvenation. So there's no worry that patient would get puffy or get like too much of volumization. And I just spread them a little bit toward the front. This way I have a little bit of tight skin even here. And as you can see, I'm moving very, very comfortably. And this is not bolus injection. This is very, very small amount that you spread. And I'm actually coming a little bit toward the front. I'm going to move it. Sometimes you may have to come out of the skin, do it. There's no problem. But now I'm coming toward more lateral side. I want to make sure I cover this area. And as you see, like I'm going almost toward her temporal and complete periauricular, actually around her ear canal, earlobe. You can see here also I'm coming very high lateral. Sometimes you have to just pull your cannula out and move it smoothly. One more time. This is would be my last actually. And you just release a small, as you actually pulling back, you injecting. I never inject forward, I always do retrograde injection. After you're done with injection, and then you do slight amount of massaging, this actually helps the product gets very nice and smooth. And you ask also the patient for 3 times a day for 3 days to just move like the way I'm doing it now, up and lateral. This is the best massage. Patient gonna feel a slightly swelling for a few days. They would not have any pain. This product already has lidocaine in them anyway. They just have to move up and lateral and make sure for 3 days, 3 times a day. That actually makes the product evenly be distributed into the skin, and then that prevents from any lumpy or bumpiness. And also you want shape it. This is the way I want to shape, up and lateral. This is the way I want actually here the skin to be pulled back. And usually I do this procedure every 6 weeks for up to 3 treatments. Most of patients, they need actually up to 3 treatments. And then we reevaluate and see how the progress goes, and then you can do it almost once a year for maintenance therapy. I hope you enjoyed this video. Okay, now is after injection of Radiesse to both sides of her lateral face. I would like to ask actually Vicky to explain to me how she feels and how was overall the procedure.
So this was my first time doing hyperdiluted Radiesse for my face, and it was so quick and easy, not painful at all. The lidocaine definitely helped initially, and she just scanned it out, and I mean, it's just amazing. Can't feel it. I can go back to work, no problem. And looking forward to the collagen stimulation and then the results in the next 6 weeks to occur. So
stay tuned for next 6 weeks.